Good afternoon, this is Dr. Do again. This video is a quarantine special edition, video number 33. Today I'm going to talk about taking care of elderly. In other words, what kind of problem the elderly people might develop. You probably know it if you have parents live with you. And in addition to medical conditions, obvious like heart disease, diabetes. In addition to this, what kind of other causes, what kind of other problem the elderly people might come across. So it's challenging, I have to say it. Taking care of older people living with you, it's not easy. How to cope, how to manage, even though not living together, but once in a while you need to take responsibility to take care of them. And what kind of hint or what kind of how to recognize those conditions might impose very serious complications or risk, or of course, first of all, let's talk about the emergency elderly. This is you probably already know it. Of course, the common cause of emergency is fall, altered mental status, or any other medical problem getting worse, like chest pain or neurological deficit. These I have talked before. If you're interested, you can follow my previous video. But in addition to this obvious emergency situation, there are a lot of special nature of older people. First of all, the emotional and the mood, or the mood fluctuation, or flat, or withdrawal, does not talk too much, or keep the feelings inside, etc. So this emotional dealing with elderly is the most challenging thing, I think, because when people are getting older, their response is slow, physically sluggish, and also they live alone. Especially when they live alone, tend to be isolated and decrease social activity, withdraw from social activity, and sometimes some of them, older people, might have negative view of life, of surroundings, and so this is a very challenge. The communication with elderly people, I think, first of all, show respect, even though they're not, they don't deserve your respect. But if you show your respect to them, it's make your job easier. It's just the patience and the respect. So first of all, give them a feeling like trust, and build the trust in either the caregiver or the relationship, relatives, whatever. So build the trust by being patient and respectful. Treat them not as elderly, treat them as children. Actually, we have a saying like the children is for young and for older. Their personality, particular personality, like revolving back to the childhood stage. So if keep that in mind. So show patience and also respect, so that the first base, the foundation, is on top of this. And then after that, you need to recognize some medical conditions, and notice elderly tend to have the dehydration, urine tract infection. Those are very subtle. These symptoms usually not recognizable. They just suddenly feel delirium or fuzzy, just not happy. No matter what do you do? They cannot lying down, they cannot sit still, and they becomes very frustrated. If that's the case, without any reason, even for example, the urine tract infection, the elderly people may not have elevated temperature. So these are symptoms without obvious, these problems without obvious symptoms, or just normal, just not regular themselves. So if this is the case, think about that. Offer just a sip of water may quench the flame, actually, to correct the dehydration. And also take to the physician, or I think some of them might have those deep urine dips. Do a dip may indicate there's an elevated white count, so it means there's a subtle urinary tract infection. If that's the case, call their physician. They will bring in or prescribe medication. So these are the subtle, very easily to be missed conditions, but will change the whole day. Will change your day. Otherwise, you just feel frustrated. What's going on with these people, or with her, or with him? And check with this small things might make everything easier. And also the other best way to deal with to take care of older people is to talk to them, find a topic intriguing their mind to move to their thinking, or answer your question or discussion. Through this talking, first of all, make them talk out, improve their mood, or make them happier. Probably they have something holding inside. After you talk, they will talk out and make feel better. And during this talk, you can identify whether there's some subtle neurological or psychological problem going on. For example, the dementia. It's a very slow process. Probably you told her yesterday, or him yesterday, you told him or her something, or today she forgot, or he forgot. So this, if just one day, it's okay. If I keep going for a month, the topic you just called or something discussed one day earlier and the next day forget. If this is the case, talk to the family or to the physician, or if you're a family, alert physician that I think this people is getting forgetful. So that's to pick up the dementia or other mental problem, whether these people have depression or anxiety or anything like this. So during your talking with them, with patient, improve your day. I mean, make your life easier and identify medical problem for these older people. And the other thing is it's very helpful and very important, fall prevention. Make sure, ask them, tell them, move slowly, regardless, either from lying down to sit up or getting up to walk. Tell them, remind them frequently, be slow, be slow, be slow. So if they, especially like I said, if they have a dehydration, subtle dehydration, if they stand up too quick or walk too quick, it increases the fall, the hypotension, the stasis hypotension. So that means dizziness and seeing sparkles and increased risk of falling. So these are the special trick might be ignored or missed when you carrying older people, especially beyond 70s or 75 or 80. So these are the challenges, very subtle, but will change life, make the caregiver's life easier, and make the patient or the people life easier, and also the family will appreciate what if you pay attention to these kind of small things. Okay, so that is the topic for this, taking care of elderly. Probably you already know it, but this is just to me, it's like a common sense, and then integrate into the medical problem, what kind of common problem elderly might occur, easily to be missed. So I'll put everything together. Hopefully it helps, and thank you for tuning in. I will see you next time.